A cold Wednesday morning in February this year, and I'm staring across the valley from my level 6 corner office at the IDI McKinnell Knowledge Center on Makerere main campus. I look at Mulago Hospital, where I was born on a Thursday night. And just next door is the Makerere Medical School, where I was privileged to spend 5 years being trained as a medical professional. And in that same one view, I see the IDI building in Mulago, where I spent countless hours as a young clinician looking after people my age afflicted by what is potentially a life-threatening illness. And in that same view, veering a slight left, I see my hall of residence at the university, Nsibirwa Hall of Residence, then the Great Northcote Hall, where I spent very good hours with colleagues. And then here I am in this office, the 4th director of the institute that is transforming lives and protecting communities from deadly bugs. It's a beautiful view and a tradition I established to smell the roses, because in my line of work, life is short, and I'm reminded every day. But this day is different, because I've made the big 5-0. I'm 50 years on this morning. And I don't know if there are people here who have hit the big 5-0. I had a lot to be grateful for, retracing my journey in that one glance across the valley. But it also came with some anxiety. Had I made the right choices? Had I stayed yoked to this institution, Makerere University, where I am based? Could I have done other things with my life? So this was the battle raging through my mind on that morning. That battle is still raging, and maybe one day I'll be invited again to tell you about it. So what I want to tell you about is what I have called reciprocal transformation. When I reflect on my life, I see that I have worked and been influenced by this institution, but also have been blessed to be able to influence the institution. And in my extra time, because of COVID, I picked up the trumpet, and every day I practice it. So as a scientist who's trying to break new ground in the art, I felt that the tango would be a fitting paradigm. So I'm going to tell you how I have tangoed with an institution, hopefully for the better in my career. The word university comes from a Latin word which means whole. But in some narratives you hear universities being referred to as ivory towers, and not in a positive way. You think of professors who have it all in their head and never interface with the real world. For my generation, and looking across the room for most of us, the real world meant coming face to face with an infectious disease called HIV and AIDS. I can't imagine, or I don't have to convince you that whatever discipline of medicine in the 80s and 90s you are practicing, everything was touched by this ghastly illness. Whether it was an adult doctor, or a pediatrician, or an obstetrician gynecologist, what you saw was death and destruction among young people in the prime of their lives, depicted in this picture that was taken in Mulago Hospital. But I want to share a story, a tango of hope, showing how the university is a community that ascends and descends down this ivory tower, going up the ivory tower to conceive models and theories and hypotheses that can then descend down the tower and translate into better health outcomes for the lives out there. And I also want to tell you a story of this tango between academics in different institutions. In my case, I was really nurtured by these academics who were going up and down the ivory tower. Now, you would not believe that when I qualified as a medical doctor in the late 90s, at government expense, and having spent 1 year in internship, paid for by the government, I could not find a job. Apparently, there was a freeze on public service employment because of structural adjustments. And so I had to moonlight in what we call research assistant opportunities. And if I hadn't done that, I wouldn't have chanced upon one of my former lecturers, Professor Kamia, who had partnered with his colleague from the United States, and they had a research grant. And he told me, Andrew, I remember you're a good student. Why don't you enroll for graduate school? And that's what happened. So very quickly, I enrolled to go back to school at a very young age. And one of the funny stories is that I ran into a professor who thought I was an undergraduate student, and yet I was a graduate student, and it was very, very, very intimidating. And I also want to tell you about the partnership between the United States and Uganda through the President's Emergency Plan for AIDS Relief, which is called PEPFAR. And I want to tell you about two amazing individuals, Professor Nelson Sewankambo on one hand, and the late Professor Mal Sande, who, at the height of the HIV crisis, came to Makerere University and said, let's establish a world-class institution that can look after people who are living with HIV in Africa. What is very interesting is that a lot of the people thought they were mad. And I was reading the memoirs of a vice chancellor at Makerere, who then was writing and saying, these people's plan looked too ambitious and unrealistic. So it's very interesting that even then, the leadership felt that this was too great a height to scale. I don't know if any of you have been to Emanyata. Emanyata is a dwelling in the nomadic communities in the northeastern part of Uganda, where people herd together with their animals. And this gives an opportunity for diseases to pass from animals to humans. So that is me, believe it or not, in one of our programs. I think what this picture shows is how a university can descend from the ivory tower to go in the community and really see how to touch with lives. In this case, how can we make sure that these communities are protected from deadly diseases like tuberculosis? And so this is the tango between the ivory tower and being in the community where the real life happens. And the final part of what I want to tell you about is a model that is unfolding at the institute where I've been privileged to invest at least 20 years of my life. It's a two-dimensional tango where, on one hand, our teams have been grappling with making HIV history. How can we anticipate sitting with our grandchildren and talking about HIV as a thing of the past? I am very privileged and pleased to tell you that this is becoming a reality every day. As I speak to you now, thank you very much. There are over 1 million Ugandans accessing life-saving treatment, and this is because of the university and other programs going and descending the ivory tower and being in the community. One of the intriguing things is that we've taken this experience of building health systems for HIV and we're able to apply them to new areas of need in the community. In 2006, my colleagues and I were reflecting, after HIV, what next? And that conversation is what led us to think about creating a program that would protect Uganda and the East African region against emerging deadly infectious disease threats. It was very gratifying in 2020 when this country was dithering with the prospect of COVID-19 coming to Uganda. I had the opportunity to sit with the Honorable Minister of Health in her official issue vehicle on the way to the airport in order for us as an institute to support the government of Uganda to make sure that the airport is secure and so that incoming passengers could be screened in a competent manner so that we preclude COVID-19. So essentially, HIV and AIDS, which was a slow epidemic, what I call an epidemic in slow motion, enabled us to go to the gym and flex our muscles so that we can now handle COVID-19. And I'm very proud of the work we were able to do to support the government, not only for COVID-19, but more recently to face the Ebola outbreak. The final thing that we're doing is to help what I call a ticking time bomb, which is antimicrobial resistance. How many of you use antibiotics? Yeah, if you don't put up your hand, you're not true to yourself. And this is a ticking time bomb. And we've seen in the news people using, for example, antiretroviral drugs in poultry and piggery. And all of this might really not do us well. So very quickly, before I come to the end, we are using all this experience to help this country think about preserving the precious antibiotics we have by using them the best way we can. The other dimension of our work is, having started in Uganda, we are really looking for opportunities to work beyond the borders of this country into East Africa. And I'm proud as a Ugandan to say that we're already working in 15 African countries, looking at how we can deploy the COVID vaccine the best we can by partnering with the Africa CDC. One of the most gratifying aspects of my work is the emphasis on African scientific leadership. A lot of the work we're doing is being led by African scientists, including myself. And I'm also glad to say that we're supporting what is called an Africa Center of Excellence for Data Science on the ground floor of this building in the next picture. On the ground floor of that building are young, brilliant people who are looking at your data, mobile phone data and other data, so that we can predict where the next outbreak is. So you can see, having stood in that corner office and peered in the valley and reflected on my life and tangled with this institution, like the Makerere motto says, I'm gratified that I too am building for the future. I thank you.